Good day, everyone. I'm Cassandra Coley Pangilinan, a student nurse from OLFU, performing cold compress and hot compress for return demonstration. To demonstrate the proper technique in applying hot and cold compresses, ensuring patient safety and comfort while achieving therapeutic effects such as pain relief, reduction of inflammation or swelling, or improvement of blood circulation. For step 1 to 6, same procedure in patient for hot and cold compress. Step 1. Verify the doctor's order for the cold compress and hot compress, including the type of moist, cold and hot application, location and duration, and desired temperature. Step 2. Review client's chart for medical history and contraindication, such as poor circulation, impaired sensation, or vascular disease that may contraindicate cold and hot compress. Step 3. Gather all materials needed bedside, the gloves, washcloth, basin, and cold water, and also for hot compress basin with hot water and waterproof pad or mat. Step 4. Perform hand hygiene as applied, clean gloves. Step 5. Greet and identify the client using 3 identifiers. Good afternoon, sir. I am your nurse for today. May I know your name?
Dominic Aison po.
Where do you live po?
De La Paz.
When is your birthday po?
November 3.
Step 6. Provide privacy at all times. Since we are in a private room, I already closed the door. However, in some instances in ward, we will close the curtains. Step 7. Explain the procedure to the client clearly and completely with client's approval. Sir, I will explain the procedure to you. The doctor ordered cold compress for your knee. It is to reduce the pain or swelling of the part of the area. This procedure will take 15 to 20 minutes. Will that be okay with you? For the cold compress procedure, Step 8. Assess the client and family's awareness, understanding of the procedure, and related safety factors. Sir, have you or anyone in your family received cold compress before?
No po.
Step 10. Describe sensation patient would feel and precautions to prevent friction and numbness. Sir, I will describe the sensation that you may feel. You may feel numbness or tingling or cold part in the area. But if you feel pain or too much coldness, tell me right away so that we can stop the procedure. Step 11. Position client in bed. Keep affected body part in proper alignment. Exposed body part to be covered. Drop patient as needed. Step 12. Assess client's skin around the area to be treated and the client's temperature and pain sensitivity. Step 13. Inspect for any wounds. There are no wounds in open area. Step 15. Place a waterproof pad under the knee. For the next step, before applying the cold compress to the affected area, I will check the temperature of cold compress then we will apply it. Sir, I will apply the cold compress, then let me know if it is too cold or uncomfortable to reduce the swelling or inflammation of the area. For the next step, if needed, remove remoisten and reapply to maintain the cold temperature as needed. Since the cold compress bag is with ice, still the same temperature, we will not remoisten it. Then stop application immediately if any untoward incident or problem occurred. Next, after 15 to 20 minutes, remove the compress and waterproof pad. Sir, it's been 20 minutes. Do you feel any improvement now?
Yes.
I will now remove the cold compress and the pad.
Almost pa pala.
Inspect the skin post-treatment. Your skin looks normal. It has no redness and irritation. Do you feel any improvement? Step 22. Help client to a comfortable position. I will now cover your knee and return to your comfortable position. Step 23. Remove gloves and dispose properly and perform hand hygiene. Identify any unexpected outcomes. There were no unusual findings or adverse effects during and after the procedure. Step 25. Document and report. I'll now document the procedure in the chart, including the skin condition and response of the patient. Hot compress procedure. For step 1 to 4, same procedure and patient for cold and hot compress. Step 5. Perform hand hygiene and wear gloves. Step 6. Assess the client and family's understanding. I will assess your family's understanding about the hot compress. Have you or anyone in your family used hot compress before?
No.
Step 7. Assess vital signs and mobility. I already assessed the patient's vital signs and mobility earlier. Everything is within normal limits and he is safe for the procedure. Step 8. Identify expected outcomes. Our expected outcomes is to reduce your back discomfort and relieve muscle tightness. It promotes better circulation and help with healing and to evaluate effectiveness. Is that okay with you? Step 10. Explain the procedure and gain approval. Sir, I will explain the procedure to you. The doctor prescribed that you will be having hot compress for your back to reduce the muscle strains and stiffness. Is that okay with you? Step 11. Describe expected sensation and safety precaution. This is the expected sensation that you will feel and to be aware and safe during the entire treatment. You might feel warmth, mild tingling, or relaxation in the area. But if you feel burning, stinging, or numbness, please inform me right away. The compress will stay on about 15 to 20 minutes. I will be checking with you every few minutes. Position the client in Sim's position and ask him permission to explore her properly. I will only expose the area where the hot compress will be applied. Sir, I will help you into a comfortable position for the procedure. Is it alright if I adjust your clothing and expose only the area where hot compress will be applied? I will make sure to keep the rest of the body covered for privacy.
Yan ako na sa
Assess the client's skin and temperature sensitivity for any signs of redness, irritation, or loss of sensation, then inspect the wounds. However, there are no open wounds. Step 15. Place a waterproof pad under the treatment area. I am now placing a waterproof pad under your back so that you keep the linens dry. Apply the washcloth to the warm water of basin and wrung out the excess to avoid dripping water, then apply it to the patient. Sir, I am now applying the hot compress. Please tell me if it is too hot or uncomfortable so that we can stop the procedure. Monitor and comfort observe skin during application. Sir, how does your back feels now?
Feels hot but manageable.
Okay. I will check your skin every after 5 minutes to check if there's irritation or redness in the area. Please tell me right away if you feel uncomfortable or it is too hot for you so that we can stop the procedure right away. Step 19. If needed, remove remoisten and apply the hot temperature as needed. Since the hot compress is still same warm temperature, we will not remoisten it. Then stop application immediately if any untoward incident or problem occur. Step 20. After 15 to 20 minutes, remove the compress and waterproof pad. Sir, it's been 20 minutes. I will now be removing the hot compress. For the next step, inspect the treated area post-procedure. I am checking your skin again. There are no redness or irritation. Do you feel much better now?
Yes.
Next is clean and store equipment. Provide privacy and your position. Now I will cover your back and then return you into the comfortable position. Step 23. Remove gloves and dispose properly. Perform hand hygiene. And then, identify unexpected outcomes. There were no burns on your back and no adverse effect. Step 20. Reassess vital signs. I will check your vital signs to compare the earlier findings so your pain is earlier is 7 over 10. What is your pain level today?
2/10.
Next, we have to document it and report. I'll now document the procedure injury, skin condition, your response, and comfort level. If you need anything, call me on the call bell. Thank you.